Morning. For years, you've heard me talk about Best Health and the tremendous impact it's had on our organization. And so now I want you to hear from one of our team members about how it's benefited her. Joining me now is Kim Strickland, a nurse manager at Baptist Tipton. Kim, thanks for taking a little time to talk to me today.
Anytime.
Well, you're kind to be here. I understand from one of my colleagues that you wrote a note to the Best Health team to share your great experience with the program. And this is kind of a dangerous question, but this is just a conversation between you and me and a few thousand of my closest friends. But would you mind telling me about your Best Health biometric screening last year and what your results were?
Sure. So I'm going to be honest with you, Mr. Little. I did not show up the way I needed to last year. So I knew I was not going to meet the BMI. I knew that I was a diabetic. My sugar was not going to be so great. And pretty much figured that my blood pressure would not be so well. So last year, I kind of went into this thinking, this is going to be a failure. Let's just get it over quick, right? Best Health team that did the biometric screening took my blood pressure, and it was 148/94. And they were like, oh, we're going to let you sit for a minute. So that didn't quite go well with what I was expecting. So my blood pressure after that was 155/101. And they asked to call my provider or send me to the emergency room.
Wow.
Yeah.
And so you're a nurse. You know these things. What are you thinking at this point?
I'm not going to the ER. No, that's not happening. So they slid me this form and very politely asked me to sign it. And I had a moment. And in that moment, I realized I didn't react well. I was like, I don't sign this form. I get other people to sign this form. It's a refusal of services form. I'm not the non-compliant person. And I would love to say that I realized it that day. It was not that day, but I was the non-compliant person, and I was the one that needed to make big changes if I was going to impact my health.
Good for you. So, and this year, you made sure that you got your biometric screen done early, I understand?
Absolutely. So the minute the calendar rolled, I called Dr. Joe Freeman here in Covington. I was in and out of the office in less than 30 minutes to establish my care and to have that biometric screening done. And I knew it was going to be different because I met Adele. Adele was his medical assistant, and she took my blood pressure, and it was 116/74. And I got the biggest fist bump from her. And I was like, welcome to a new year.
Wow. Well, congratulations. That's amazing.
Thank you.
Those are terrific results. Well, let me ask you, did you earn any Best Health rewards for that decrease in blood pressure?
Well, yes, sir, I did. I earned $50 for that decrease in blood pressure. And since I did go to a BMG provider, the next day I pulled into the parking lot coming to work and had a jingle on my phone, and it was my MyChart, and I was able to look at my lab results less than 24 hours from when they had been drawn, and my blood sugar, guess what?
Tell me.
It was 79.
That's awesome.
So that earned another $50.
All right.
Yeah, so I had $50 for blood pressure, $50 for blood sugar, $100 for actually going to have the screening completed. So the only thing that I did not meet was my BMI. And that's when I reached out to the team at Best Health because I've had a pretty big change in my BMI, and they asked me to send them a snapshot from my MyChart. So this time last year, my BMI was 48.13. This year, it was 35.36, and that is a 27% decrease.
Kim,
I literally lost a fourth of myself in 1 year.
Kim,
Praise
that's
the Lord.
Awesome. Praise the Lord's right. That is terrific. That's inspirational. So what's next? Are you going to engage with Best Health more this year, and what's next on the horizon?
Absolutely. So I have enrolled in Go Healthy with Patrick. It starts September 15th. It's like at 5 o'clock in the afternoon, so I'm excited because I can do that after I get off work. And I'm also working with the Best Health team. They have a group of folks that will put together personalized exercise regimens for you. So I know we're all kind of struggling with the pandemic and getting to gyms, and let's face it, personal training is very expensive. So this is an awesome opportunity to help them, help get expert help on how to get the results that I want in the gym.
Good deal. Anything you tell other team members who have similar health challenges?
Don't be ashamed. We all have health challenges. Some of them you can see, some of them you can't. Don't be ashamed and commit to making yourself better so that you can better provide care for others.
That's great. Well, you know, my appointment to see my physician for biometric screening is next week. And so thank you for sharing with me. You are certainly an inspiration to me. And I know other folks around the system who need to make some health changes will be similarly inspired by hearing your story. So I appreciate you sharing with us. And I want to say thanks to everybody for watching this video today. You know, if you're struggling with diabetes or high blood pressure or obesity or other health issues, Baptist Health really can help guide you to a better quality of life. You'll feel better physically. You'll be taking steps to ensure that you'll be there for loved ones for years to come. And so I really just want to encourage everybody who's out there watching this video today. If you have Baptist Health Insurance, you've got to do 3 things before November 13th. Please don't let this sneak up on you. Before November 13th, to avoid paying that $80 per month tobacco surcharge. Nobody wants to pay that money. If you can avoid it, do 3 things. Complete your health risk assessment, get your biometric screening, and then submit the results of your biometric screening to Best Health. And you'll be on the path, hopefully, to rewards and great changes in your life the way Kim has made. But thanks again, Kim. Thank you for sharing. And I hope everybody out there has a great day.